Assalamu alaikum. Our lecture today is about myelofibrosis. And myelofibrosis is a malignant hematological, one of the hematological malignancy in which there is replacement of the bone marrow by connective tissue. It is a rare disorder affecting elderly patients, in which there is a chromosomal abnormality like genus kinase 2 mutation, STAT pathway, and STAT is the signal transmission and activation of transduction. And the second abnormality is the retinoblastoma gene mutation. Retinoblastoma gene mutation. JAK2 in fact is intracellular tyrosine kinase, and you should be familiar with the tyrosine kinase, as it is probably the leading cause of chronic myelogenous leukemia, responsible for enhancing proliferation of the granulocyte and inhibition of apoptosis there. Genus kinase as intracellular signal transducer, and it enhances proliferation of the pluripotent stem cell into excessive megakaryocyte. And this megakaryocyte produce a cytokine called fibroblast growth factor. Fibroblast growth factor. And this fibroblast growth factor enhances the proliferation of the fibroblast and this is responsible for fibrous deposition in the bone marrow and the replacement of the bone marrow by connective tissue. And the early stage of the disease, the hematopoietic cells become crazy. So it starts to proliferate, producing premature white blood cell and premature red blood cell, and this is manifested peripherally as leukoerythroplastic picture. Leukoerythroplastic picture. And there is ineffective hematopoiesis. Where these premature cells distracted in the bone marrow, causing increase in the LDH and increase in the leukocyte alkaline phosphatase. Leukocyte alkaline phosphatase. increase also. And then this hematopoietic cells migrate into the liver in order to produce extramedullary hematopoiesis, causing hepatomegaly. And to the spleen, cause splenomegaly. To the lymph node, cause lymphadenopathy. And to the lung, to the pleural membrane, causing pulmonary hypertension. Clinical manifestation: 30% of those patients are present with splenomegaly and mild anemia. They might present with weight loss. They might present with pruritus, night sweat, fatigue, and all of these necessitate investigation showing the classic leukoerythroblastic picture and teardrop cell. Then to start with, leukoerythroblastic picture and teardrop cell. When the red blood cell starts crying on the bone marrow. Teardrop-like red blood cell. As I mentioned previously, leukocyte alkaline phosphatase elevated, LDH elevated, red blood cell become low, white blood cell probably start in the early stage might increase, later might decrease, platelet in the early stage might increase, in the later stage might decrease. So, and then we need to confirm the diagnosis, confirmation by JAK2, detection of JAK2 mutation. Treatment: largely supportive treatment if the patient develop anemia, blood transfusion or erythropoietin, or if the patient develop infection, treatment of infection or giving granulocyte colony stimulating factor, and then erythropoietin, granulocyte colony stimulating factor, or thrombopoietin, or treatment of infection, gamma globulin, or probably of help, monoclonal antibody, and the only cure, the only hope to cure the patient is by stem cell transplant. And it's carry its morbidity, especially in the elderly patient with comorbidity. Probably a small percentage of patients susceptible or probably might benefit from stem cell transplant. Thank you.